everyone could please take your seats, we're going to get started. All right. So welcome back from lunch. Hope you all enjoyed a pretty amazing and exciting morning. I, for one, am like, wow, Dr. Kadabi's, ambient device, that's really amazing. I didn't know that we were already there, so that's really awesome. So right now, we're going to be doing one of my favorite parts of the network forum. It's sort of a tradition, I think, that we've started. It's our oral medley, which is kind of like a lightning rounds. So basically, we have 52, I think, posters outside, and we've sort of selected 13 to showcase here, just to give everybody a little bit of a taste of what's out there. Of course, they're not going to be able to all present everything, but just again to give you a little taste, and hopefully will kind of whet your appetite and get folks out there. Hope you can go see the posters during any of the breaks, during the lunch, today, tomorrow, and also our reception. So essentially, we're going to have 13 presenters in 13 minutes give you a quick overview of their work. So a slide's going to go up. If you guys want to go ahead and just come to the side, lined up. They'll each have 1 minute. So this slide deck is actually on a timer. So even if they wanted to go over, they wouldn't be able to. So it's going to be 1 minute for each person with a 5-second transition. All right, so we're just going to go ahead and get started. Yes. Yeah, they know. They have their instructions. So after, yeah. All right. All right. So let's start with the first one. Come on up.
All right. So my poster is on fear of cancer occurrence, coping in a mind-body intervention. So 50% of cancer survivors endorse elevated fear of cancer occurrence, and In Focus is a pilot randomized controlled trial that evaluated the effectiveness of a synchronous virtual mind-body group resiliency intervention for fear of cancer occurrence. And coping strategies were measured for problem, emotional, and avoidant coping strategies using the Beat Cope. And perception of coping ability was measured using the MOX-A for coping confidence, relaxation, assertiveness, and awareness of tension. And from baseline to 5 months, compared to usual care, In Focus increased both problem-focused and emotion-focused coping strategies, decreased avoidant-focused coping strategies, and improved participants' self-perceived ability to cope. And interestingly, no effects were observed for denial or self-distracting coping strategies or awareness of tension. Thank you.
We conducted a study looking at the impact of a 4-week compassion-based intervention training called Heart Smile Training. The goal of this training is to encourage embracing compassion and loving kindness within the body to enhance and nurture bodily awareness. We were able to collect behavioral, neural, and autonomic data, and we were able to use all of that to better understand the impact of this training. We found that there was an effect in reducing depression symptoms following the HST training. There was also an increase in interoceptive awareness. And then as far as the EEG results, we looked at heartbeat evoked potentials, which are the cortical response to body signals, measuring the brain cardiac coupling. And we found a decrease in HEP amplitude after the HST training. This can indicate a better compassion towards oneself in relation to their EEG signals. So if you want to learn more about this, I'm at poster 10.
I'm going to use the extra time. This is for all the insomniacs out there, and there's a lot of you. The focus is on acoustic resonance therapy for sleep. We all know about the pharma solutions. They're effective, but have a long list of side effects. CBTI requires a change in bedtime routines and behavior where compliance can be challenging. And then we have acoustic resonance therapy delivered in just a few simple steps. You take a scan of your face with a smartphone, and then put on a wearable headband and just listen to pleasing music for about 45 minutes before you go to bed. And the reason the music is pleasing and unique to you and personalized is that we actually use your cranial resonance from the face scan And we also use binaural beats, which basically entrains your brain to frequencies that put you in a relaxed and meditative state of mind. So we dropped the ISI score, which is the Insomnia Severity Index, by about 11 points with no side effects and 100% compliance. Thank you.
Good afternoon. So we know that meditation has a profound impact on the brain, but what does it do to the rest of the body? So we used a cutting-edge molecular technique called proteomics to identify 5,000 proteins in 77 participants after an advanced meditation retreat. We found two important things. First, pro-inflammatory signaling is down in meditators after the retreat. And we also identified novel biomarkers that may constitute a specific signature in your blood for meditation. So this has important consequences for meditation as a complementary therapy for chronic inflammatory diseases like autoimmunity and cancer. And I'm excited to explore this research further. Thank you.
Hi, so I'm Riku Ihalainen. I'm a postdoc working at the Sadhguru Center for a Conscious Planet here in Boston. And I'm interested in deep meditative states and advanced meditations and the apparent modulation of conscious awareness that seems, at least reportedly, is often accompanied by these practices. And so here we did run a retrospective data analysis on EEG data collected from a group of advanced Shunya meditators while they were practicing the Shunya meditation, which focuses on emptiness and on conscious non-doing. And we made a number of interesting observations that I'm happy to talk about in more detail, either by the poster, which is number 21, or in person during the conference. So if you see me around, feel free to come by and talk to me. And yeah, I hope you have a nice time while here in Boston. Thank you.
Hi, my name is Diane. My poster is about a secondary analysis that we did with a recent clinical trial about opiate use disorder. First, we did a structural equation modeling analysis with the cross-sectional data from the baseline data of the trial. And we identified a psychological mechanistic pathway from adverse childhood experiences to self-critical rumination, to pain catastrophizing, to pain interference, which is a measure of how pain affects people's daily lives. And this pathway was significant even after controlling for depression and anxiety. And then we replicated this finding from as past analysis of the longitudinal data from this clinical trial in which adverse childhood experience still affected the amount of reduction in self-critical rumination at week 8, which then further influenced the reduction in pain catastrophizing at, sorry, that was over, at my poster 22.
Hi. So chronic lower back pain is the leading cause of disability worldwide, and current research suggests that acupuncture can be an effective and non-invasive treatment option compared to medications, injections, and surgery. So despite this, acupuncture still remains a rather inaccessible treatment because, as we all know too well, with COVID-19 hindering in-person treatment options. So the aim of our study was to develop an accessible, non-invasive, effective, and easy to integrate treatment form of acupuncture. So we created a video-guided acupuncture treatment that uses one's own mind to simulate touch. And in this way, we can maintain that essential mind and body connection. So we created a video-guided, so through 2 randomized studies, controlled studies, we found video-guided acupuncture had comparable effects to traditional in-person acupuncture, with both treatments resulting in a decrease in pain intensity and also decrease in bothersomeness to daily life. So from these results, we can speculate that these video-guided treatments models can facilitate current acupuncture treatments, but also allow a wider range of patients, not only more agency in their care, but also access to pain relief. Thank you.
Hey, so the impact of visual data on the diagnostic accuracy of multimodal large language models remains relatively underexplored. So to address this, we evaluated the accuracy of 3 multimodal LLMs on 160 case reports from the Lancet Clinical Picture Quiz. Each clinical vignette and diagnostic question was tested with and without relevant medical images to compare performance using multimodal versus textual inputs. GPT-4 and Claude perform similarly, significantly outperforming Lava. And notably, adding visual data did not significantly improve performance for any model. So these results suggest that in our evaluated context of zero-shot learning, where models are tested on tasks they have not been explicitly trained for, that these models may not yet be optimized to integrate image and text features critical to clinical reasoning, at least in our data set.
Okay, so we brought in 80 people with migraine headaches for a mechanistic neuroimaging trial. We randomized them to one of 4 intervention groups. Come by our poster to learn more about the really cool controls we had, but our double active arm, the one we were most excited about, combined an 8-week mindfulness-based stress reduction program with a vagal nerve stimulation device that we gave participants to bring home and use daily. Dr. Vitaly Napadow is going to tell you more about this device in like 15 minutes, so stay tuned. But essentially, we're stimulating vagal afferents in the ear as people are exhaling. So it's very much linked to the breath. The hope is that combining that with mindfulness meditation that is also breath focused will have a synergistic effect on migraine pathophysiology. So we're assessing that through 7T fMRI, PET scans, sensory outcomes, and our outcomes are looking at things like neuroinflammation, central sensitization, and autonomic dysfunction. This study just wrapped up, so this is more of a protocol paper at this point, but stay tuned next year, hopefully, for some exciting results. Thank you.
Hi, my name is Morgan Pratt. I'm a clinical research coordinator at the Sadhguru Center. We actually have a booth out in the lobby, so please stop by and some of my study team members will happily discuss our additional studies. Branch explores how regular meditation may impact brain age and sleep microarchitecture. We focus on brain age index, which is the difference between estimated and chronological brain age, as well as sleep patterns, particularly looking at if there are more percentages of sleep spent in deeper sleep stages versus lighter sleep stages. Our study uses a wearable EEG headband to measure sleep, as well as an oximeter ring, in addition to neurocognitive tasks to assess cognition and emotional performance. I do have some of our preliminary findings listed here, but with those up there, I'd love if you guys would come join me at my poster booth 41, to discuss the study further. Thank you so much.
A little early. My name is Anna Tanasievich. I'm the Senior Clinical Research Manager at the Zakem Center. I'm presenting today on behalf of Dr. Weidong Liu and our co-authors. So as many of you know, hot flashes are a common and disruptive side effect of endocrine therapy for breast cancer patients, resulting in poor quality of life and treatment adherence. We conducted an international study with 158 women across the US, China, and South Korea. Participants were randomized to receive either immediate acupuncture with 20 sessions over 10 weeks or a delayed control group. After 10 weeks, women in the immediate arm saw a remarkable and clinically significant reduction in their hot flashes, cut by about half, while the control group saw minimal improvement. We also saw significant improvements in quality of life in the immediate acupuncture group. Interestingly, the extent of benefits varied across the countries, potentially indicating differences in cultural and clinical factors. In summary, acupuncture is an effective, well-tolerated treatment to reduce hot flashes and improve quality of life in women undergoing endocrine treatment for breast cancer. Thank you.
Hello, I'm Lee Valo, Clinical Fellow at the Center for Mindfulness and Compassion. Thank you for this opportunity to share findings from an RCT comparing the effectiveness of 3 online treatments targeting depression, anxiety, and stress in the wake of the pandemic. The first, CHA Mindwell, is a soft touch population mental health screening and stratified care program. The second added mindfulness-based cognitive therapy for resilience, a synchronous group treatment. And finally, the third included ICBT, an asynchronous individual skills building program. MBCTR was predicted to be the most effective program. However, while findings indicated significant improvements across all 3 study arms in measured health outcomes, no significant between group differences were found, suggesting the comparative effectiveness of CHA MindWell on its own. Looking ahead, ongoing analysis include broader healthcare usage data as well as mechanistic factors. We're also looking at ways to innovate CHA MindWell as a conduit for evidence-based therapy to improve healthcare equity and access. To learn more, please visit us at poster 48. Thank you.
Hi, everyone. I'm Maria from MIT, also CEO and co-founder of Health Plus. Burnout affects 18-ton professionals. However, due to stigma, employees don't seek for help, and the companies lack HR insights for proactive management. At Health Plus, we make burnout prevention automate. HRs get a dashboard with the real-time risk insights with the data from medical claims, workflow, as well as HR data to help them to better allocate resources and manage workflow. While employees get an app using digital phenotyping for quick burnout screening, and then we suggest them with a personalized stress management mechanism. We already have very promising first results with our 31 participants with a decreased stress level, increased productivity, willingness for seek for treatment, as well as burnout awareness. And Maria, please check us out during the poster session. Thank you.
All right, let's give one final applause to all of our presenters. All right. Did we want to get a poster or a photo of them in the front? Yeah, okay, great. So for those of you that don't know me, I just realized that I didn't introduce myself before. So my name is Gloria Ye, and I serve as the Director of Clinical Research at the Osher Center here. So I'm particularly excited about the research posters. All right. We'll get started with the next plenary as soon as the photo's done. And I hope that you are all inspired to go see the posters that we have outside on the second floor. All right, wonderful. All right, thank you so much. Awesome, go see those posters. All right.